Well, some 3 million Americans receive Botox injections each year to turn back the hands of time and erase their wrinkles. Now, 4 people are in the hospital with botulism poisoning, and health officials are trying to determine whether the injections were to blame. All the patients received Botox treatments from the same clinic in Florida. Joining us now to talk about Botox dangers is board-certified plastic surgeon, Dr. Emily Pollard. Good morning, Dr. Pollard.
Good morning, Cindy. How are you?
Fine, thanks. Can you tell us in pretty simple terms what makes up Botox?
Botox Cosmetic is a highly purified protein made from the Clostridium botulinum. That makes a toxin that actually weakens the muscle.
When you heard about these 4 people being hospitalized, what was your reaction? Because you use Botox in your practice, don't you?
I certainly do, and I was very concerned and very surprised because there's a long safety record involved with Botox. They've been using it for a couple decades now in millions of patients in 70 countries, and the FDA has approved it. And again, the company has a very long track record of safety.
What could have caused this? Possibly having too much of the Botox injected, or maybe having a bad batch?
Well, you know, I can't really comment on that Florida case because I don't know all the particulars. But again, we use such minute amounts of the medication and so highly purified that it's very unlikely that anyone would fall ill from that medication.
Apart from using Botox to decrease the wrinkles in someone's face, what other uses do you have for Botox?
Again, there are many uses of Botox. One is to treat facial tics. I probably need it now. Facial tics or painful muscle spasms that someone can develop. Even children with cerebral palsy are being treated with Botox at much higher doses than what we're using in the cosmetic industry.
I read recently that recent studies showed that Botox was helping women who had just undergone reconstructive surgery after breast cancer surgery. Have you heard anything about that?
Yes, that information was presented by a board-certified plastic surgeon at the recent national meeting here in Philadelphia in October. And what he described was using the Botox to actually relax the chest wall muscles after the breast has been removed and after reconstruction. And they found that there was an 89% reduction in the amount of narcotics that the women used right after surgery.
Have any of your patients ever had any strange side effects from Botox?
No, there are some very rare side effects from the administration of Botox, one being pain at the site of injection, possibly some bruising, and sometimes a headache.
So at this point, people should not be too alarmed by these 4 cases?
No, but I think that there are things that they should keep in mind. Number one, they should know the provider, the physician or the medical provider who's injecting them. They should know that they are going to a qualified place, a clinic. You know, parties are a wonderful place to eat and drink, but they're not a place to receive a medical treatment.
Okay, so make sure that the person that's doing the injections is a certified doctor, and don't hesitate to look into their history, right?
Correct.
Okay, Dr. Emily Pollard, thank you very much for joining us this morning.
Pleasure. Have a good morning.
You too. Log on to epollardmd.com for more information about cosmetic surgery.